When a mother discovers that she's carrying a baby, she's about to give life. But at times, she runs out of luck and things turn out to be bad. Welcome to the show. I'm Teacher Zita. Today we have a topic and we have a guest who is Melissa. She's going to tell us her story about molar pregnancy. It was a very traumatizing story. Let's listen to her. You might be outside there. You could have gone through the very same thing. You could share with us your story. It's a journey to motherhood. Let's get started and we get all the experiences from Melissa. Thank you for joining us once again. Hello, wherever you're watching from, it's a journey to motherhood. I'm Teacher Zita, and in today's topic, we're going to talk about molar pregnancy. Molar pregnancy is a kind of very rare pregnancy. It is very unusual, and in most cases, we connect it, we think it is something that is connected to witchcrafty, something that is connected to bad luck, but it is real, it exists, because we've talked to ladies, we've talked to mothers who have ever gone through it. And today's show, we have a mother who has gone through the same experience. She's here to share with us. Welcome to the show. I'm Teacher Zita. It's a journey to motherhood. Hello, Melissa.
Hello.
Welcome to the show.
Thank you.
Say hello to the viewer. Tell us your names, what you do, where you stay.
Hello, viewers. Thanks for watching us. I'm called Apio Melissa. I live in Kampala. I do foods and beverages, and I also deal in business.
Okay. Melissa, today our topic is molar pregnancy. Have you ever heard anything about that?
Yes.
You got molar pregnancy?
Yes, I did.
When was that?
It was in 2014.
2014.
Yes.
Was it your first child?
No, it wasn't.
It wasn't your first child?
It was my third pregnancy.
Okay. Tell us your experience as a mother with the first children. How was it? Was it having a lot of complication before we go to the molar? Your first children?
Of course. Unfortunately, I lost two of them.
You lost two children?
Yeah, of course.
All the first two children?
Yes, I lost them. The first one, I lost the first one at childbirth. Then I lost the second one at 1 year and a half. Then the third pregnancy was a molar pregnancy.
Melissa, what happened to the first child?
The first child
At birth?
At birth, it was prolonged labor. And
How old were you?
I was 20 years.
Were you in a government or private hospital?
Private hospital.
What prolonged that labor? Were you far from the hospital?
No, I didn't get labor pains, so I was induced. And even the induction refused. They tried to use tablets, they tried to use the drip, the injections, but then at the end we lost the baby. Did
you have any medical complication by then?
No.
You were totally normal?
I was totally normal. I only had the complications in the beginning of the pregnancy.
What happened in the beginning?
In the beginning, the experience of the vomiting,
the nausea, the
morning sickness, loss of appetite
was extremely bad on your side.
Extremely bad.
And were you helped by the medics?
No, I wasn't. I wasn't at all.
Oh, you didn't go to the hospital?
I did.
What did they tell you?
They told me it was normal. It was normal. It was a normal experience.
That was with the first child?
The first child.
So you carried on and normalized with time?
I normalized at around six months. I normalized. But I carried the pregnancy up to around 9.5 months. So when I consulted the gynecologist, they decided to induce me with the tablets. Then after the tablets, after some 3 hours, there was no change. They decided to go for the drip.
So in the process of that labor, in the process of that induction, was the labor tense or it was just still?
It was tense. It was tense.
So what was failing you to push the baby out? Wasn't it time or?
No, the cervix did not open. By the time it opened, the baby was already tired.
So you pushed the baby well?
I pushed the baby well, but it came out when it was tired.
It was tired?
Yes.
For how long did the baby live?
30 seconds.
Only 30 seconds?
30 seconds, yeah.
And then the second child?
The second child, it was a C-section, by the way. The baby was there. Then
still the cervix could not open?
of
So
course.
this side you decided to go for
To
C-section.
go for the C-section.
Was it successful?
Yeah, it was.
So for how long did the baby live?
The baby lived for 1 year. Then, the day the baby was going to make 1.5 years, the baby fell sick for only 2 days and I lost him.
It was a boy?
Yes.
How about the first one?
The first one was a girl.
What explanation did the doctors give you when you lost this second child?
The second child? We didn't get any because when the baby fell sick, I was in the village. I'd left the baby with my mother. So they called me and they told me the baby is sick and we decided to board and come back because they had gone for the burial. So the baby fell sick on Friday. I came back on Saturday. Then on Sunday, as we were trying to rush to the hospital, we lost him on the way.
So you never ran any, you didn't do any test?
They did. It was malaria infection when I wasn't around.
Sorry. Okay, now the second child has also gone. Now here comes the third child.
The third child.
And what happened with the third child?
The third child, I conceived. And after conceiving, after conceiving, we had to go for the scan after 3 months. But unfortunately, they told us it was a molar pregnancy. By that time, I didn't know anything about the molar pregnancy.
Did you take a scan?
Yes, I did.
And you saw everything that was in the scan?
Of course, I saw everything.
How was it looking like?
It was...
At least for the baby, a normal child, you can see the posterior, the side.
You can see the posterior, but this one didn't have a fetal heart. Because normally when you go to the scan, at least they show you how the heart pumps, that fetal heart, and the movement of the child. But this time, the fetal heart wasn't there.
So did the doctor explain to you what could have happened? What could have caused it?
They tried, but at that time I had the trauma, the stress. I don't even remember.
You don't remember anything they told you?
Yeah. But they told me it's normal. I wasn't the first person. But you know, when you go outside there, people tell it's witchcraft, it's this, you try this, you try this. At first, I couldn't believe it in me because I tried herbals, by the way. I tried different scans. I even went to Kampala. I went to Kampala Imaging Center to try another scan and see. But again, it was the same results.
They were telling the same thing?
They tell me the same
So
thing.
did the doctors tell you, help you out to bring out the baby?
Yeah, they did, because the only option was to evacuate me. Yeah, that was the only option. But fortunately, he had made a program with my gynecologist to help me evacuate it. But we had made an appointment on Sunday. Then on Friday, I fell sick. So when I fell sick on Friday, I called him and he wasn't around. So this time, I've been... during that pregnancy, you know, you experience the same experiences you experience when you're pregnant. So I got malaria, and I had to go to the lab to check, and the results turned out positive. So the mistake I did was to self-medicate myself. Little did I know that the tabs I took were wrong. So when I took them in the evening, at night I started feeling abdominal pain.
Which tablets were those?
I took duocotexin. So at night I started feeling that abdominal pain. Little did I know that the thing wanted to come out.
It had affected the baby.
It had affected the baby. So when the pain worsened on that rushing on looking for the way out to go to the hospital, I just had something pushing itself out. Then it came out.
Wow. This is Melissa. She's taking us through her journey as a mother during molar pregnancy. You could be outside there watching, not knowing what causes molar. We shall have an opinion from the doctor. He will tell us more about molar, what could be causing molar, and how best we can avoid it. Because it's a rare kind of pregnancy, but it's there. We get it. Sometimes we think it's witchcraft. Sometimes we think it is bad luck. But if you listen to Melissa's story, perhaps mothers, we should stop self-medication. Melissa, back to you.
Yes.
After that experience, how did you feel? What came into your mind?
No, you know, when in society, people give you different suggestions. At me, I thought it was witchcraft. In fact, in me, I thought it was bad luck. Yeah, in fact, there's a time I even started blaming myself. I thought maybe I'm not meant to be able to be a mother.
Do you have any child of your own as for now?
Yes, I have two.
Oh, that's very good. They came after this one.
Yes, they come
We
after
shall have a
this
very brief break, and when we return, we shall hear from the doctor. He will tell us his opinion as far as molar pregnancy is concerned. Please stay with us. Don't go away. This show is sponsored by Madagascar Nursery School. We are located on Entebbe Road, Kawoku Kachindu Trading Center. You can reach us on those numbers running on the screen. Madagascar Nursery School, nurturing amazing children.